Another priority for the American people is lower health care costs. And despite the many promises, Obamacare is not delivered. So this week, the House is acting on solutions to help families and foster innovation, from strengthening Medicare Advantage to repealing the medical device tax. In addition, the Supreme Court could soon make a ruling that leads to millions of Americans losing their health care subsidies. Our goal is to provide peace of mind to families who have coverage disrupted through no fault of their own. Obamacare is fundamentally broken, increasing costs for millions of American families. And the plan we're working on will focus on protecting the American people, offering new choices for quality, affordable health care, and not protecting this failed law. Yesterday, we had a constructive meeting with our members, received good feedback that will help inform us as we continue to develop our plan.
You mentioned protecting people who are going to lose coverage through no fault of their own, which makes some sense. It's millions of people. Why coalesce around a policy here that is going to cause a political fight, repealing the individual mandate? We all understand your opposition to Obamacare. Why not extend subsidies and get some concessions on some other things that Republicans want, instead of doing something that's going to be veto bait and have a clash over Obamacare and potentially end subsidies for people?
Well, clearly, we're interested in protecting those millions of Americans who could lose their subsidies. But as I said, we are not interested in protecting a fundamentally broken law. And we're doing everything we can to increase choices for Americans, lower cost, and increase the quality of the health care they get, which is all being undermined by Obamacare.
But knowing that the president feels exactly opposite of that and can never sign a repeal of the individual mandate in these intervening times before an election, if the subsidies are repealed in these states and Americans with health insurance is the concern, doesn't it make more sense to get some concessions that you can and extend those subsidies until an election?
We have an obligation to do what our constituents ask of us. And I think our position on Obamacare has been perfectly clear for years now, and frankly has not changed. As a matter of fact, I would point out that the more we learn about Obamacare, the more we learn just how fundamentally broken it really is.